Let's talk about whiplash and cervical curve. So you see this all the time, you hear about it all the time. Whiplash is not a diagnosis. Whiplash is a description of a type of traumatic event. The diagnosis should not ever be whiplash. The diagnosis should be figuring out what's going on with what level of the spine and what ligament or what structure is damaged. Your brain controls everything in your body. It sends energy down through the spinal cord, comes out through the nerves, and they control every cell, tissue, and organ throughout the entire body. So it's a very, very important structure protected by armor, which is your spine. So that curve is also a protective mechanism because it acts like a shock absorber. So when you walk, when you jump, when you do anything that causes compression, the curve naturally absorbs shock. When you have a curve in the spinal cord is in a nice relaxed position. The spinal cord is elastic, it can stretch, but it should not be existing in a stretched position. When someone has a car wreck, it goes like that and they lose the curve, okay? If they have a really bad car wreck, it goes like that and they have a reverse neck curve. That's pretty much how it happens. With that said, this x-ray up here, we have this person's facing this direction like this. This is a really bad reverse neck curve. It's called a cervical kyphosis. So the spinal cord runs down this path right here. And like I was saying earlier, the spinal cord is supposed to be in a nice relaxed position. In this case, do you think it's relaxed or do you think it's stretched and under tension? It's stretched and under tension. And there's a nerve that comes out between all the bones through these holes, and those nerves go to your thyroid, your heart, your lungs, parts of your head, pretty important things. And those nerves are going to be pulled on and tugged. And if you had to guess, do you think those nerves are going to work properly when they're under tension as well? They're not. These are bending x-rays. This is taking that same patient and having them bend their head down as far as they can. They can bend down pretty easily because their neck's already halfway in that position when they're looking straight forward anyway. So they can bend down, but look how abnormal that bend is. It's not uniform, it's not universal. It's happening almost like a V. So there's fixation here. These joints are stuck, they're not moving properly. And then this is bending the head backwards as far as they can go. This is nowhere near where they should be. This is technically almost a normal looking curve if the person was looking straight forward. But instead, they're bending their head back as far as they can, and that's the only way they can simulate somewhat of a normal curve. So ultimately, the curve in the neck is one of the most important structures in the whole human body. And that's a bold statement, but that's a very true statement. So when someone has a whiplash mechanism of injury, car crash, they're hit from behind, there's many different mechanisms that can create that loss of cervical curve or reverse cervical curve. The important thing is identifying it and then actually going through proper treatment to restore it. And most chiropractic methods do not restore the curve of the neck. You can't restore it with adjusting the joints alone. You can't restore it with exercise. You have to do a combination of things, but one of the key things that needs to happen is spine remodeling traction. And so that's another thing. If you have a cervical kyphosis, you have to find a very specific type of doctor to be able to rehabilitate it properly.
You see the level of expertise that we have here of diagnosing and explaining to you exactly what all of this means. This is something that can be written off by lesser providers or by insurance adjusters or by other attorneys as just whiplash. What we're looking at here is just whiplash.
There's a lot to it. You need to make sure that you find someone that knows what they're doing with this. It's not something to mess around with. If gone untreated, this will cause lifelong problems 99% of the time. We're talking about how to prevent having to go down the road of surgery in most cases. Sometimes it's needed, but in most cases there's things that can be done conservatively.
Sooner the better.
Sooner the better, always.
Video presentation by Meridian, Idaho Car Accident Chiropractic. We dedicate our service to Meridian, Idaho, auto accident victims who have been in a car collision and have experienced personal injury. Idaho law allows motor vehicle victims to pursue personal injury claims legally, and if you are not at fault, your chiropractic healthcare is covered 100%. The doctors of chiropractic at Meridian Car Accident Chiropractic in Meridian, Idaho, are specially trained to diagnose and treat hidden injuries following a car collision. If you or a loved one has been injured in any type of motor vehicle crash, we are here to help you get your life back on track. We provide clinical, diagnostic, and treatment excellence. We accept car crash victims, whiplash injury victims, commercial truck accidents, and motorcycle accident victims. There is no fee for you, your loved ones, and your friends to seek chiropractic care at Meridian, Idaho Car Accident Chiropractic. Call now 208-581-4353 and let's get you back on your feet.